first story has something for everyone.
In a study done by the CDC in 2019, over 20% of adults were dealing with chronic pain that affected everyday activities. In addition, 85% of people will experience back pain at some point in their lives.
So traditionally, pain management used to consist of more medication management rather than more targeted and innovative procedures that we do precisely under image guidance. There was a lot less evidence base when the specialty first came to be, and we've learned a lot. We have a lot of data, a lot of more innovative procedures, a lot of targets with which we use in an advanced way and a specialized way to treat a lot of these pain conditions. Whereas prior, this usually was treated with pain medications, some physical therapy, nerve pain medications, and a lot of opioid narcotic medications, which we have thankfully strayed away from. In the appropriate setting, opioid prescription medications can be completely adequate and they are appropriate for instances like palliative care, hospice care, cancer-related care, or other extenuating circumstances where they have their role. Overwhelmingly, for musculoskeletal pain, joint pain, and nerve pain, there's such a wide breadth and scope of available options as well as safe and evidence-based treatments that have really just progressed and catapulted over the last 10 to 20 years, where now there's just so many more efficacious methods of treatment available. The most common treatment conditions that we treat in our practice typically are neck pain or back pain, sciatica pain, headache management, chronic nerve pain, neuropathy.
Dr. Jay Shah is making it his mission to show people that you do not have to live with pain forever. The SamWell Institute for Pain Management provides high-quality patient care for those trying to get back to the things they love.
I have some personal experiences as well with pain-related conditions. I unfortunately have also had a number of back surgeries myself due to just horrible car accidents when I was younger, and having gone through that experience firsthand, it really showed me what it's like to have horrible back pain and pain that radiates down my leg, and how the post-operative recovery really is. All of those sentiments resonate with my patients as well as myself, and I'm able to relate to them on a little bit of a different level, on a personal level. My mother was also diagnosed with breast cancer, went through all sorts of treatments for post-operative and post-cancer treatment pain. And having seen that and having seen at a young age what interventional pain specialists are capable of doing in those circumstances was life-changing for me. So there's a number of different things that kind of just threw me into the space, and I love what I do every day, and I'm very fortunate to be able to help people.
For the interventional part, our doctor, he does not prescribe any opioids. He wants to stay along the interventional aspect. He offers lots of options, whether it's doing injections, minimally invasive procedures, or even doing some physical therapy that can help with the pain. That's something that we really do try to stand on as a group, just promoting, health and wellness for the patient, doing what they can to do better in the future with their pain, and pretty much doing anything that we can on our end to make sure that they're feeling good.
We're pretty easy to find. The process in terms of new patient intake and being seen in our office is pretty simple. We make ourselves very visible and accessible. So in our practice, we are a little bit more modernized and digitalized, where patients can actually chat with us online through our website directly with an actual individual, not an automated robot. They can also text with us, and they can also book their appointments and follow-up appointments online through an automated system that we have.
So the patient experience is very important to us here. We want to make sure that you feel calm, safe, because we see these patients that are in the worst pain of their entire lives. We know that that affects them physically, mentally, emotionally, so we just want to help them and make them feel as comfortable as possible. I will bring the patient in, go over their past medical history, figure out where they're having pain, discuss with them what treatment that they have had, any imaging that they've done, where their pain triggers, anything like that, and then I'll relay the message to Dr. Shah.
So I first came to Dr. Shah as a recommendation from another doctor that I had been seeing. Back in 2018, I was in a car accident with my 14-year-old son, and I suffered neck and back pain injuries, and I've been seeing doctor after doctor after doctor for the last 4 years almost, and I kind of was at my wit's end. Walking in the door, the staff at the front desk is super friendly, very patient, and very thorough with explanations, even with wait time. So that's a good sign. The facility is beautiful, decorated gorgeous, and very comfortable, which I also like, and it's clean. And just meeting Dr. Shah, he doesn't talk to you, I don't know, like a doctor. He talks to you like a person and is very thorough with all of his explanations. He will talk to you in layman's terms so that you understand what's exactly happening, rather than I'm going to do this procedure and this procedure with all these technical terms. He talks to you so that you, the patient, really understand what you're going to be experiencing through his treatment.
At SamWell, it's all about a customized approach to getting better.
It's so important that patients realize that there are other options other than just physical therapy, opioid pain medications, and having surgery for certain issues. There's such a wide variety of safe and evidence-based options that are available for standard issue aches and pains that people usually have, such as neck pain or back pain with sciatica, headache management, chronic nerve conditions, as well as more complex conditions such as complex regional pain syndrome, complex nerve issues, diabetic peripheral neuropathy, and even chronic pelvic pain. It's so important that patients realize that there are these options, because there's a very large lack of education in our society about how to treat a lot of these things. We are, in a society where everybody reaches for a pill, or really does not have the awareness or education from the physicians in their particular community to let them know that, hey, you actually have a lot of other options that are available. It can be surgically sparing, it can be opioid reduction and opioid sparing in a lot of the instances with which we treat pain. And I think it's really important for people to understand that with these options, their quality of life does not have to become compromised.
I like his energy. I just like the way he presents himself. Like, I show up and I'm like, hey, and it's like, it feels like a familiar face. He feels really like laid back. He's cool. I love talking to him and just feel like I'm talking to like a friend. And, hey, what's going on? It's great. You don't get that with a lot of doctors. You really don't. It's awesome. It feels good to talk to a doctor that, I can see at eye level with.
If you're in chronic pain, I would definitely, recommend you coming to SamWell. Our doctor, Dr. Jay Shah, he's amazing. He takes care of all of our patients. Everyone is super happy with him. They'll recommend him to coworkers, family, anyone that they know who's in pain and that we could help them.
Pain is essentially an emotion. It's an emotion that can affect you mentally, cognitively, physically. It really can affect not just your entire life, but that of those around you as well, your loved one, your family, and your friends. It really affects your whole life. So we take that 360-degree approach in our practice with each individual that walks in. There are many patients that, they've been given several different options, whether it's take this pill and this opioid pain medication, try some physical therapy, or I can refer you, for a major surgery, which they may or may not need. There's always another option. The last option, which is an unfortunate consequence that people think, is that I can just live with the pain. I don't want to do any of those options. And all too often, we hear a lot of patients that end up on our doorstep and they call our office because they, for years, have thought that I didn't think anything else was available. I've seen other specialists and other physicians and other therapists and other providers who have really told me that that's it. There's nothing else that can be done for your condition. And so they opt for that latter option, which is I'm just going to go ahead and live with the pain, which is really unfortunate. And I really think that the reason our field is so special is because we inspire hope on a daily basis.
A different approach to pain relief and functional restoration is the best way to help you get better. If you'd like more information, visit samwellpain.com or check out this segment again at thebalancingAct.com.